Classification of dosage forms. Dosage forms may be classified on the basis of physical form, route of administration and sterility of the final product like non-sterile dosage form. This consists of solid dosage form, liquid dosage form, semi-solid dosage form. Solid dosage forms are available mostly in unit dosage form. Tablets. Tablets are classified as oral tablets, buccal tablet, sublingual tablets, chewable tablets, lozenges, vaginal tablets, effervescent tablet, film-coated and sugar-coated tablets. Tablets are solid dosage forms of medicaments which are prepared by molding or by compression. Certain excipients are added to the medicaments in the formulation of tablets. The compression tablets are prepared in bulk by the large-scale production methods. The ideal tablets should be free from defects like cracking, chipping, discoloration and contamination. Aspirin tablets, paracetamol tablet, chloroquine tablet etc. With reference to their route of administration, the tablets are classified as oral tablets, buccal tablet, sublingual tablets, chewable tablets, lozenges, vaginal tablets, effervescent tablet, film-coated tablets, sugar-coated tablets etc. Capsules. Capsules are the solid unit dosage forms in which one or more medicaments and inert substances are enclosed within a small shell, generally prepared from a suitable form of gelatin. Depending on their formulation, the capsule may be available as hard gelatin capsule or soft gelatin capsule. The drugs having unpleasant odor and taste can be administered by enclosing them in a tasteless shell. Pills. Pills are small, rounded or spherical solid dosage forms containing medicaments and are intended to be administered orally. The medicaments are mixed with excipients to form mass. The mass is rounded into uniform pipe and cut into number of pills. Now the pills are outdated, as it is difficult to prepare pills of uniform size and uniform weight. Powders. Bulk dosage form, are the solid dosage forms of medicaments which are meant for internal or external use. They are available in crystalline or amorphous form. The bulk powders meant for internal use are supplied as granules or fine powders. The bulk powders meant for external use are dusting powders, insufflations, snuffs, dentifrices, sprays and aerosols. The dusting powders are meant for external application to the skin in a very tiny state to avoid local irritation. Dusting powders are divided as medical and surgical dusting powders. The medical dusting powders are used for superficial skin conditions and surgical dusting powders are used in body cavities. The dusting powders are mainly used for their antiseptic, astringent, absorbent, antiperspirant and antipruritic action. Insufflations. These are medicated powders meant for introduction into the body cavities like nose, throat, ears and vagina to produce local effect with the help of an apparatus known as insufflations. It sprays the powder into a stream of finely divided particles all over the site of application. Snuffs are finely divided solid dosage forms of medicament which are inhaled into nostrils for its antiseptic, bronchodilatory and decongestion action. Dentifrices. These are the tooth powders applied with the help of toothbrush for cleaning the surface of the teeth. They contain a suitable detergent, abrasive and flavoring agents. Liquid dosage forms are meant for internal, parenteral and external use. They are available in monophasic and biphasic dosage forms. Monophasic dosage forms are represented by true or colloidal solution. The water is used as solvent for majority of the monophasic system. A solutions is homogeneous because the solute is in an ionic or molecular form. In case of colloidal solution, the solute are present as aggregate through they cannot be seen by the naked eye. Monophasic liquid dosage forms are available as liquids for internal use, syrups, elixirs, solutions, linctus, drafts and drops. Syrup is a concentrated or saturated solution of sucrose on purified water. The concentration of sucrose is 66.7% W. The syrups are sweet viscous preparations. The syrups containing medicinal substances are medicated syrups and those containing flavored substances are called flavored syrups. Generally, syrups are used as sweetening agent and vehicle. Syrups are now used for formulation antibiotics, antihistamines, sedatives, antitussives etc. Elixirs are sweet alcoholic or hydroalcoholic preparations intended for oral use. The alcohol content of elixir varies from 5 to 40%. Elixirs containing therapeutically active compound are known as medicinal elixirs. The medicinal elixirs contain potent drugs such as antibiotics, antihistamines and sedatives. Solutions are liquid preparations containing two components, namely solute and solvent. The smaller components present in the solution and are usually non-volatile as the solute. Solvent is the larger components present and is also known as vehicle. Linctus. Linctuses are viscous liquid and oral preparations generally prescribed for the relief of cough. They contain medicaments which have demulcent, sedatives or expectorant action. These are sipped in small doses and swallowed slowly without the addition of water. Draft. Draft is a freshly prepared liquid oral preparation taken as only 1 or 2 dose. Drops. Drops are liquid preparations meant for oral administration. The oil-soluble vitamins such as vitamin A and vitamin D concentrates in fish liver oil are presented as drops for administration. Liquids for external use, liniments and lotions are applied to the skin. Gargles, mouthwash, throat pain, Veyes drops, ear drops, nasal drops and douches are meant for body cavities. Liniments. Liniments are liquid preparations meant for application to the skin. Liniments are usually applied to the skin with friction and rubbing of the skin. Liniments may be alcoholic or oily solutions. The alcohol helps in the penetration of medicaments into the skin and increases its counter-irritant action or rubefacient action. Lotions. Lotions are liquid preparations meant for external application without friction. They are applied direct to the skin with the help of absorbent material like cotton wool. Lotions may be used for local action as cooling or protective purposes. They are prescribed for antiseptic, for example calamine lotion. Gargles. Gargles are aqueous solutions used to prevent or treat throat infections. They are available in concentration form with direction for dilution with warm water before use. They brought into intimate contact with the mucous membranes of the throat and allowed to remain in contact with it for a few seconds before they are thrown out of the mouth. Potassium chlorate gargle, phenol gargles, etc. Mouthwashes. Mouthwashes are aqueous solutions with a pleasant taste and odor used to make clean and deodorize the buccal cavity. Generally, they contain antibacterial agents, alcohol, glycerin, sweetening agents, flavoring agent and coloring agents. Compound sodium chloride mouthwash BPC throat paints. Throat paints are viscous liquid preparations used for mouth and throat infections. Glycerin is commonly used as a base because, being viscous, it adheres to mucous membranes for a long period and it possesses a sweet taste. Mandel's paint. Sprays. Sprays are preparations of drugs in media which may be aqueous, alcoholic or glycerin. They are applied to the mucous membranes of nose or throat with a tomixer, known as nebulizer, which removes droplets. The droplets are able to reach the lungs. Adrenaline and atropine spray. Nasal drops. These are solutions of drugs that are installed into the nose with a dropper. These are usually aqueous and not oily drops. The nasal drops should be isotonic, having neutral pH and viscosity similar to nasal secretions by using methyl cellulose. Douches. A douches is an aqueous solutions meant for introduction into the body cavity for medical treatment. They are commonly vaginal solutions and generally called irrigations. Douches are also used to irritate the eyes, ear or nasal cavities for cleaning or removing foreign particles from these cavities. Biphasic dosage forms. The liquids which consists of 2 phases are known as biphasic liquids. Emulsions and suspension. In general both the phases are liquid, while in suspension the finely divided solids are dispersed in a liquid which acts as continuous phase. Emulsions. An emulsion is a biphasic liquids preparations containing 2 immiscible liquids, one of which is dispersed as minute globules into the other. The liquid which is converted into minute globules is called the dispersed phase and liquid in which the globules are dispersed is called the continuous phase. Normally 2 immiscible liquids cannot be dispersed for a long period. So, an emulsifying agent is added to the system. It forms a film around the globules in order to scatter them indefinitely in the continuous phase, so that a stable emulsion is formed. The emulsions are of 2 types, oil and water type emulsions, O-W, water and oil type emulsions, with O. Suspensions. The suspensions are the biphasic liquid dosage form of medicament in which finely divided solids particles are dispersed in a liquid. The solid particles act as disperse phase whereas liquid vehicle acts as the continuous phase. Suspensions are generally used for internal and used for external applications. Semi-solid dosage forms. Semi-solid dosage forms are mainly meant for external application, ointments, creams, paste, etc. Ointments. Ointments are semi-solid preparations meant for application to the skin or mucous membranes. They usually contain medicament dissolved, suspended or emulsified in the ointment's base. They may contain suitable antimicrobial preservation. The ointments are mainly used as protective or emollient for the skin. Creams. Creams are the viscous semi-solid preparations meant for external use. The creams are of two types, aqueous and oily creams. In aqueous creams, the emulsions are oil and water, and in oily creams, emulsions are water and oil type. A suitable preservation is added in creams to prevent the bacterial fungal growth. Creams should be stored and supplied in well-closed containers which prevent evaporation and contamination. Paste. Pastes are semi-solid preparations intended for external applications to the skin. They differ from ointment as they contain high proportions of finely powdered medicaments like zinc oxide, calcium carbonate and starch. These substances make the paste very thick and stiff. The stiffness property of paste makes them useful as protective coatings. They are used mainly as antiseptic, protective or soothing agents. Pastes should be stored and supplied in containers made of materials which do not allow absorption or diffusion of the contents. Jellies. Jellies are transparent or translucent non-greasy semi-solid preparations used for external applications to the skin. The substances like gelatin, starch, tragacanth, sodium alginate and cellulose are used in the preparations of jellies. B. Internal use administered to body cavity. X. Suppositories and pessaries. Suppositories are the solid or semi-solid preparations meant for inserted into body cavities like rectum, vagina or urethra to provide local or systemic therapeutic effects. The suppositories are melts at body temperature, dissolve in the body fluids and release the medicament. X. Zinc oxide suppository, boric acid suppository. Pessaries. Pessaries are semi-solid mass or oval in shape meant to be inserted into the vagina for local and systemic effect. They may be prepared by molding or by compression. 2. Sterile dosage forms. Injections. Injections are the sterile liquid preparations and are administered by the parenteral route under or through one or more layers of skin or mucous membranes. The injections are preferred in case of emergency when prompt action is desired. X. Ampicillin injections, gentamicin injections, etc. Eye drops. Eye drops are liquid sterilized preparation of drugs dissolved in aqueous vehicle. It should be free from microbial contaminations. They should be prepared in aseptic conditions. Eye drops should be made approximately isotonic with lacrimal secretions by the addition of sodium chloride. X. Streptomycin eye drops, pilocarpine eye drops. Eardrops. Eardrops are liquid sterilized preparation of drugs. The drugs are dissolved in the vehicle like water, alcohol or glycerin or propylene glycol and administered into the ear with the help of dropper. 3 to 4 drops are instilled in the affected ear. Generally used for cleaning the ear, drying weeping surfaces, softening the wax and treating mild infections. The container should be labeled, for external use only. X. Chloramphenicol eardrops, hydroperoxide eardrops. Ococerts. They are the ophthalmic inserts, or the new drug delivery systems for administered the drugs to the eyes. These are iridescent in such a way that they release the drug at predetermined and predictable rates, thus eliminating the frequent administration of the drugs by the patient. They are elliptical in shape, the dimensions 13.7 times 5.7 mm and 0.3 mm in thickness. Implants. Implants are sterile dosage form which is inserted under the skin by surgery. Drugs is released for long time, about 3 to 6 months or even 1 year. X. Testosterone, steroidal hormone implants.